Good morning. My name is Phuntsho Norbu, and I'm the country connector from Bhutan. In my presentation, I will share the impact of Research4Life in Bhutan by first providing a brief context of its early milestones and then updating the current situation. Mainly, I'll be focusing on the local publishers' efforts to contribute to the global scholarly communications environment. For the early milestones, it started back in 2005 when WHO conducted its first Hineri training for our health institutes and the Ministry of Health. This marked a transformative moment as it resulted the initial registrations following the training. Through partnerships and grant support, additional workshops were conducted between 2009 till 2019, which further played a critical role in advancing Research4Life in Bhutan. However, despite these workshops organized for more than 15 years, there was still low usage, primarily because no organization took the lead in advocating the Research4Life in the country. So through technical support, continuous support from the Research4Life and initiatives such as Research4Life Country Connectors, now we are able to at least take a lead to conduct advocacy programs and training our users. So an official designation of a country connector with our institution is, I think, playing a critical role, and we are very thankful to Research4Life and its partnerships. So currently, what is the situation in Bhutan? Our tertiary institutions are the top users in the country. So basically, there are less than 20 tertiary institutions. So what we do is our institutions fully depend on Research4Life. It is a primary source of our academic resources. So basically, our students and faculty depend on teaching learning. And especially in the last few years, we have tried to integrate evidence-based curricula. So basically, when our universities and tertiary institutions develop or revise curricula, we make sure that we train our curriculum developers, faculties, to make use of evidence-based resources. So basically, we want to enhance evidence-based teaching learning, and also to improve the quality of teaching, learning, and also decision makings. And recently, we have also, in my university, I think we conduct a lot of research methodology workshop for our faculty members, clinicians, and other researchers from the ministry. So what we do is also during the research methodology workshop, we make sure that we go and train our researchers so that from the initial stage of their research process, they are aware of Research4Life resources, and we want them to use it as the main resources, especially for literature review and other evidence-based quality improvement of their research. So basically, they know now. But then before that one, there are still, access is not automatic. Obviously, Research4Life has been there for more than 20 years in Bhutan, since its first initial registrations. But then still, we come across our colleagues that are not aware of Research4Life and forget about the awareness. They do not know how to access it. So basically, that is where it plays a critical role for us to go and make a presentation. That is where they know that it is a legitimate source, because with many illegal sites, I think we are also becoming a victim. Our users also become victim, and then they also have to understand a little more about how predatory journals are also taking advantage of our researchers in low middle income countries. We prioritize ambassadors, especially through Country Connectors project. And in Bhutan, so we have conducted 2 ambassadors workshop in the last year. Basically, the last one was in December. So we brought in almost 20 ambassadors from more than 13 high tertiary institutions. So basically, we had 3 days of workshop, capacity development workshop for our ambassadors. So basically now, we invested with support from Research4Life country. We conducted 3 days of workshop with little more than 1,000 USD. So with little more than 1,000 USD dollars, we organized 3 days capacity development workshop. Immediately after the workshop, from February till May, our ambassadors cascaded this approach to their users. In turn, they went back to their universities, institutions, and they trained. So basically, in last 4 months, they have trained more than 4,000 users. So basically, I am trying to emphasize that a small support means a lot for us to reach to our users. And now in the second part, I'm going to focus on how our local publishers are working to contribute to the global scholarly communications environment. I'm from the University of Medical Sciences of Bhutan. So our university launched our first Bhutan Health Journal back in 2015. And I remember in the initial years, in 2016, I went and presented about the importance of indexing to our editorial board. Basically, that time, I also did not have much idea about how indexing works, the reality of currently we know DOAJ and other many indexing databases. But then basically, I just had little knowledge, theoretical, but then I did not have practical knowledge. I obviously tried that we need to work on it, but then it did not materialize until 2023, where we were accepted. Now, as per our managing editor of the Bhutan Health Journal, which we published a blog in 2024, it says that now our Bhutan Health Journal is seeing increased submissions from our healthcare professionals, including from the neighboring countries. So there are publication submissions including neighboring countries. So basically shows that a simple process such as indexing in the DOAJ, and now we have also indexed in Scopus, that is attracting regional researchers to publish with our local journal. Having said that, that is the good news. Now, in 2023, when Research4Life collaborated with DOAJ, and they requested me to find the list of publishers in the country, I could manage at least 15 publishers were there. So we requested, but then only 5 managed to attend in November 2023 when DOAJ training was conducted. Now, this year, in the first quarter, I was trying to connect to those 15 publishers. There are many challenges that they are facing. As of now, Bhutan Health Journal is the only journal that is indexed in DOAJ and Scopus, and then at least there are now 10. So basically 3 or 4, 5 has not been able to continue their publications. There are many challenges. One challenge is lack of technical capacities. So they are not able to host their journals. And then there are preferences by our researchers to publish in the global north publishers. It does not mean that the researchers have gone down. Researchers are increasing every year. It's just that we do not have our local publishers' journals indexed. That is where our researchers prefer to publish in the global south. In my university, there are professors who have more than 30 publications. So they have published with the international global north publications. Now that is where we need support. And I have tried to contact with at least 3 publishers. They shared that they are not able to get regular submissions, and then they are not able to meet the indexing criteria that is there. So henceforth, what is our plan? So we are again coming back. We obviously in our local context, we are trying to get support from our government. We're trying to help each other, but then there are also some things that is not in our control probably. So that is where I want to establish formal collaborations with Research4Life and other partners and see if we can work together. So a webinar, one single webinar can also make a difference to help our publishers to set up and then probably fulfill our goals in making sure that in the next few years we want to have more journals indexed and then integrated in Research4Life so that our publications are also visible to the global north. And then we also want to contribute from our country. With this, thank you so much, Research for Life.